Alright, this is my scar 8 days after my MVD surgery. The stitches are still in. They're actually coming out in about 2 days. Thank you, Christina. So I had that MVD surgery done last Monday. It seems like it kind of worked so far, but I'm kind of nauseous all the time, dizzy, a little weak. Pretty much everything you'd probably expect recovering from a brain surgery, and haven't really been commenting too much on my support group page because I really want to be completely healed before I give any kind of advice on this. As far as my glossopharyngeal neuralgia, I never had sharp shooting pains that most of the stuff describes on the internet. What I have is just a constant dull burning sensation under my tongue, like an earache, kind of ice needle feelings going in my ear all the time. It was just always there. I never really had like this sharp shooting intense pain that I see described on all the medical stuff. But anyways, I just wanted to show that scar for just so I don't know. Hopefully I didn't freak nobody out. That's actually going to heal up really well, I'm sure. Right now it looks pretty bad. When I had my Eagle syndrome, styloid removed on the right side, I also had a sewn up scar just that bad, but as you can kind of see now, it's right here. You can barely even see anything, but it looked just as bad as that caterpillar looking thing on the back of my head. But so far, and why I'm posting this is because a lot of people have Eagle syndrome. They get the styloid removed and they still have sore throats, earaches, feeling of swollen lymph node, which I'm trying to get rid of. And I think this MVD surgery is going to work. As what I could tell so far, the swollen lymph node feeling right here feels like it's completely gone. The feeling in my ear feels like it's completely gone. It almost feels numb, and it kind of feels like if I was coming down from a mountain right before your ear pops, like a high altitude pressure feeling where I can't hear exactly as well as I should, but the pain's completely gone in that ear. And considering I've been living with this for like 12 years, it might just be the feeling of a normal ear, and that might be the reason why it feels numb to me. It's really hard to tell yet because of the surgery being so fresh. As far as the surgery, it was one of the worst ones I've had to go through yet. With the hospital stay and everything, I went in there thinking that right after the surgery I'd be resting a lot, but that's not the case at all. In fact, they wake you up every single hour to check on your vital signs and have you go through some questions, which you might want to know if you have that MVD surgery coming up, thinking that you're going to get a lot of rest, or you might want to go in there tired like I was thinking. Not that it's going to be easy to sleep the night before brain surgery anyways, but that was the case with me. I was kind of thinking I'd get a lot of rest, and it was the complete opposite. I was woken up every hour to pretty much ask me what my name was, what hospital I was in, just normal, pretty much normal questions, same questions every hour, just to make sure that my brain was functioning right. So I'm just posting this video as a part 3 to the little thing I'm trying to do here to help other people out who are still feeling symptoms after they have the styloid removed. I can't really say exactly that it worked 100%, but right to me right now it feels like it's a lot more to the yes than to the no, but I feel kind of nauseated a lot and just weak. I just been laying in bed. The most I've done is gone to the grocery store and done a little bit of shopping. But it feels like it works. I just don't want to jump the gun, and as you can imagine with looking at that scar on the back of my head, it's really hard to tell what I'm feeling still because there's a lot of healing to be done still, and this whole area in general is just really kind of numb. My ear feels completely numb, like, I mean, not numb to the touch, but I don't know if I was just getting those shooting pains in my ear all day long, and now I don't get them, so it feels like there's something weird because this has been going on so long. Anyways, I'm just posting this as a part 3 to the video. After this, I'm going to post my actual surgery, which I should be getting on Thursday, and then I'll probably have a part 5 as a follow-up a couple weeks down the road once everything's healed up, so I could really say what all happened. On my last YouTube video, somebody posted how they really liked the panoramic picture that I showed, and so what I'm going to do now is point out the styloid process on my panoramic a little more detailed and slowly, so you can do this at home. This panoramic was done by any oral surgeon. The best thing to really do is find an oral surgeon that knows what a styloid process looks like and where to look for it. It was a 4th oral surgeon that found mine finally, so between that and somebody posting a comment about how they liked seeing that panoramic, I'm doing this real quick too. So what we're looking for and what I'm going to point out is this is a picture of the styloid process that was removed from my right side 2 years ago. It looks kind of like a fang. It's like a big bone, like a big hook bone fang thing. Now I'm going to point it out on the panoramic to try to help somebody else out at home. It's really faint, but if you pay close attention, once you see it, you'll never really miss it again. So here's my panoramic. It's kind of hard to get this going. Now here's the left side. This is the area you want to look for, right behind the cheekbone on the panoramic. Here's a picture of the whole panoramic to kind of give you a better idea where you're looking at, the very far corner. Now this was the normal side. It's you can see there's kind of like some calcification stuff going that way past the cheekbone. Now here, hopefully this is coming in good, but here this is kind of a pain in the butt. But right here, there is the styloid process. It's very faint, but it's, if you look past this cheekbone right here, the cheekbone line, you're looking in this area right below the ear, and there's a very faint fang-like item right there, and it's going vertical, and you'll see actual some faint vertical lines outlining it. On the normal side, the left side, there's nothing vertical at all that you can make out. On the right side, hopefully you can see it.